even before I was aware of the virtual visit platform, I'd been thinking about the fact that if we could create or access a platform like this, it could revolutionize the way we do pediatrics.
For us, telehealth is an enabling piece of several of our strategies. So our ability to actually enable some of our payment models, to actually enable our population health strategy, our growth strategy, our insurance plan strategy, and several of our other opportunities across the health system.
So we have a direct-to-patient system that we call virtual visits. We have a site-to-site system, which is where one of our physicians in the hospital is communicating to another healthcare facility, working with patients remotely. And then we have remote home monitoring.
There was quite a ramp-up period where we had a lot of learning, both from the patient aspect as well as the provider aspect and some technical aspects.
When I identify a patient in my practice that would be a good candidate for this and they agree to it, I just send a message to the virtual visit team. They schedule the patient, do the tech checks, and it's seamless from that point forward.
I was very concerned that would I be able to virtually have the same type of connection that I can in a room? And I find that it's really as effective as it is within the office.
My patients really enjoy seeing my face on the video for some reason more than seeing me in the clinic, but they are in comfort of their home, and they seem to enjoy that, even like on a cell phone.
I had one visit that I did with this gentleman who has lots and lots of visits for other chronic conditions that he needs to be seen at the hospital for, but he got to do a visit from home with his brand new puppy that I got to see that he wouldn't have gotten to show me otherwise. So I think that face-to-face connection is definitely still there.
I've been doing like some weight management visits in pediatrics. And by doing it virtually, I can do my interview like I would in clinic. And then I have the parent go to the kitchen and show me what's in the refrigerator.
Having the opportunity of having diabetes educators and nutritionists participating in the discussion of giving fast feedback on the scope of diabetes management.
The office hours that they keep right now to run a clinic isn't always conducive to each family's current situation. So to be able to do slightly different hours, maybe from home, maybe not necessarily in the clinic, and to be able to offer that flexibility is really important to a lot of our providers.
Patients really appreciate being able to have a visit with me, but not lose a half a day of work.
It allows us not to have to bring in sick kids into our clinic environment, which means that we're just decreasing the chances of well kids getting sick.
Physicians love to take care of patients. They love to treat patients, they love to interact with patients. And telehealth allows them to do that in a very personal way, in a way that brings them more deeply into their patient's world.
In 5 years, if not sooner, that more than 50% of pediatric urgent care and follow-up visits will be done virtually. I think that could happen today. It's just a matter of comfort and culture change.